Best days to get pregnant. Determining the best days to get pregnant involves understanding the menstrual cycle and identifying the fertile window, which is the time when a woman is most likely to conceive. Here are some key points. Menstrual cycle. The menstrual cycle is typically counted from the first day of one period to the first day of the next period. The average menstrual cycle is around 28 days, but it can vary between individuals. Ovulation. Ovulation is the release of an egg from the ovary, and it is a crucial event for pregnancy. Ovulation usually occurs around the middle of the menstrual cycle, approximately 14 days before the start of the next period in a 28-day cycle. However, this can vary depending on the length of the menstrual cycle. Fertile window. The fertile window is a time frame when conception is most likely to occur. It includes the days leading up to and including ovulation. Sperm can survive in the female reproductive tract for several days, while the egg is viable for around 24 hours after ovulation. Therefore, the fertile window typically spans several days. Tracking methods. There are various methods to track the menstrual cycle and identify the fertile window. These include tracking the menstrual cycle length, observing changes in cervical mucus consistency, using ovulation predictor kits, and monitoring basal body temperature. Additionally, there are smartphone apps available that can assist in tracking and predicting ovulation. Individual variations. It's important to note that every woman's menstrual cycle and fertility patterns can vary. Factors such as stress, illness, and hormonal imbalances can influence the timing of ovulation and the fertile window. To maximize the chances of conception, it is generally recommended to have regular, unprotected intercourse every 2 to 3 days throughout the menstrual cycle, especially during the fertile window. This approach helps ensure that sperm is present in the reproductive tract before ovulation occurs. If you are actively trying to conceive, consulting with a healthcare provider or fertility specialist can provide personalized guidance and support based on your specific circumstances and any underlying fertility concerns. Thanks for watching my videos. Please subscribe my channel.